Hey, my name is Sarah Beth, and I'm going to be sharing with you a story that I think is important because it highlights the importance of collaboration and communication between healthcare professionals and also trust. So, the story that I'm going to be sharing is about a time whenever I was in the hospital for clinicals, and I was with the nurse, and the nurse practitioner was coming around and rounding. And this particular baby had been satting at like in the 70s all day long, and she'd been having signs of respiratory distress. And every now and then she would, bump back up to the 90s, like 94, 95, and she'd sit there for a while, but just for the most part, she was just not doing well. She was on NIMV, she was not doing well on that setting. So, whenever the nurse practitioner rounded, the nurse brought up her concerns, and she was like, "Look, I've been watching this baby. She's been sitting in the 70s. She's showing signs of respiratory distress. I really think we need to change something in her orders." And so the nurse practitioner went in, looked at her, and she came back out, and she was very not nice to the nurse. She was saying, she was like, she's doing just fine, and she's showing no signs of respiratory distress. Her O2 stats look great, like she looks really good. And the nurse was like, "I understand that she does that every now and then, but she just keeps dropping." And the nurse practitioner just would not listen to her, and she was treating her very inferior, and like she didn't know what she was talking about. And I don't know, that really stuck out to me. I wanted to share that story because not only does that affect me like going into my own nursing practice, I think it's very important to advocate for your patients, and that nurse didn't give up either. Like, she kept advocating for that baby. But I think that this experience for me going into my nursing practice helped me really solidify the fact that I want to be that advocate for the patient, and not just, the nurse prac said this, so okay, like we'll just brush it off, but really truly advocate and be like, "No, I've been watching her all day and I'm seeing what's going on, and I think that something needs to change." And I think that's really important going into nursing practice, and I also think that that really reflects leadership as well, to stand up and advocate. And I think that even though that's not a leadership position, that does show leadership and backbone and standing up for what you think is right. And so I think that this story is very relevant to the nursing practice, because I think that whenever nurses' insights on the patient status are valued by practitioners and doctors and just the healthcare team, I think it's important for everyone to listen to each other and collaborate. It definitely leads to better patient outcomes. And I think that the entire healthcare team is integral to that. And I think that hearing one another out and collaborating with one another is an important part of healthcare and should not be neglected, especially due to pride or arrogance. Thank you.